Hey, what's going on? Dr. Taylor, Aspire Chiropractic. Today, I want to give a little love to the IT band. Actually, no, I want to take a little love away from the IT band. IT band gets too much love. What is the IT band? Okay, so, little anatomy here. We've got our spine, our tailbone, our pelvis, top of the hip, thigh bone, kneecap, tibia, or lower leg. The IT band is a large swath of tissue, for lack of a better word, that runs along the outside of the leg and connects down here into the shin, okay? Now, it's an iliotibial band. It's just this fibrous band of tissue. It's connected up top here by a muscle called your TFL, tensor, it's just TFL, the tensor fascia latae, something like that. It's got some connections in here into your quad. It's got some influence from all four of those muscles. It's got a little VMO, VLO here. It's got some stuff going on with your tibialis anterior. But what does it do, right? It's a stabilizer of the hip and the knee, okay? Because it connects to all these things. But, like I said, what do I want to do? I want to take some love away from it. Stop smashing your IT band. Now, IT band syndrome is a thing, right? But the IT band is not a muscle, right? It's just fibrous band of tissue that it's like my freaking tie here, right? If a whole bunch of other stuff that could actually move and do things were connected to my tie, then my tie would be like the IT band. The IT band doesn't do anything except get pissed off and then get way too much attention paid to it. So, you hear about IT band syndrome. What is it? It's numbness, it's burning on the outside of the leg, it's stiffness. Don't you love this penmanship? So all this stuff kind of going along outside here, and then you'll really feel it kind of like right below your belt, if you will, kind of right there, or right in at the knee, and then just this real tender to the touch feeling on the lateral or the outside part of the leg. But the issue is, since the IT band really doesn't do anything aside from provide an anchor point to a bunch of other stuff, to legitimately treat the IT band like aggressively is an incredible waste of time, and it's really only going to prolong your healing time. Because what happens? So if we've got let's go back over to the other side here. Remember all this? We're over here, we're just going to be dealing with the bones for starters, okay? Got that, got our kneecap, boom, boom. So if we've got an issue with our foot, let's say it's our ankle, right? And our foot is rolled in, okay? That's going to cause our knee to buckle in, which is going to put more stress on the outside here, because what's it going to do? This muscle here, the TFL, that thing's going to want to spaz up to put some pull and some tension on that IT band to try and get that knee to come back out, right? And why is it doing that? It's because the ankle's messed up. So, bad ankles, flat feet are going to cause IT band syndrome. If we've got a knee that's twisted, right? So if this ankle falls in, or if the knee gets twisted first, it's got this internal rotation, which is going to cause that ankle to fall in. Same thing, we're going to get that put on there. Flip side, if we've got bow legs, right? If this thing is, if this is falling out the other way, like that, then that's going to put tension, stress, and pressure on the bottom of the IT band. But what's going to happen? We're going to say we've got IT band syndrome, and then you're going to get people foam rolling the hell out of their IT band and just beating this thing to death, but not fixing the issue that we've got going on in the ankle, not addressing the thing we've got going on in the knee. Or if we've got some sort of misalignment in the hips and pelvis here, causing a short leg. Not an anatomically short leg, but a physiologically short leg. Because remember, your hips come up and they connect like into your hip bones, but if our pelvis is off, where those hips connect is going to be off, causing a short leg, which means we're going to have differential stresses on our IT bands. But then what are you going to do? You're going to go to your gym buddy, or you're going to go to your crappy CrossFit coach. There are great CrossFit coaches out there. Kalen Sims, Derek Nelson, two of the best. But there are a whole bunch of crappy ones out there. Oh, just foam roll it. Get the foam rollers with the knuckles on it. That'll really help you out. No, that's just going to make you hurt before class starts. Because what you're doing is you're putting stress and pressure and damage on the thing where the symptom is, PTOM, where the symptom is here in the IT band, but you're not addressing what's causing the symptom. Your bad low back, your jacked up knee, your crappy shoes dropping your ankle in. That's what's putting stress on your IT band. Hell, even your quads. Your knee's going to roll in. That's going to piss off your VMO here. Or if you got some flat feet, which is causing tension and stress on your tibialis anterior. And again, like I said, we mentioned these SI joint issues. But what are we going to do? We're going to go after the place where it hurts, where the symptom is, which is not a bad place to start, but it's a terrible place to finish. Your starting point and your ending point shouldn't be the same spot. So, stop paying attention to your IT band. Or if you are paying attention to it, ask it where its friends are. Hey, IT band, how's the knee doing? How's the ankle? How's the hip? How's the low back? How are the shoes? Stop paying so much attention to your IT band. But again, this is the stuff we do here in this office. Because again, what do? We look at the person's symptom, but then we look at the person. We look at 100% of the person on everybody's first visit. This is why we do a full body exam, full body neurologic and orthopedic test, full spine x-rays, things like this, so we can assess this whole thing. So I don't tell you to go foam roll it, and you're like, well, what the hell? I've already been doing that. It didn't work. No. We look at the whole body, so we fix the whole body. I'll help you anytime you walk through that door right here at Aspire Chiropractic, where we're ready to help you when you're ready to be your best. Naturally.